The long-term care industry has many other sub-industries within it. First, we'll start with assisted living. These are industries that just provide daily care for its residents. Next would be skilled nursing facilities. Now, skilled nursing facilities is a little bit different because it requires direct nursing care 24 hours a day, 7 days a week. Hospice facilities provide end-of-life services. And then home health care, which is one that's really beginning to grow, is where they provide those services at home. And then finally, the latest trend in long-term care is what's referred to as LPC facilities, life planning communities. Life planning communities, they start out as independent living retirement homes. Then they move to assisted living, and they provide skilled nursing, and then finally hospice. Though each one of these homes provide a different level of services, there's key stakeholders within each one of these facilities that make this whole thing run. And those are the users of WorkSync. Number one, the facility administrator. Now, their job is making sure that the patients are being cared for while staying on a budget. Easier said than done. Next would be the staffing coordinator. The staffing coordinator looks at this massive spreadsheet of every single position for every hour of the day to make sure that they have ample coverage 24 hours a day, 7 days a week, with the right type of skills, certifications, attributes. Next would be the department manager. One of the ones that we want to focus on the most, because most department managers are like other department managers in other industries, with the exception of the nursing manager or a director of nursing. They are responsible for that state-regulated direct nursing care. And then last is payroll and HR. Now, the truth is, for the payroll manager and HR manager, there really isn't any different between this industry and others. Every industry is faced with lots of challenges to be successful, but the long-term care industry has some very unique headwinds. It comes down to cost, compliance, and coverage. So from a cost perspective, long-term care industries nationwide rely on over $300 billion for them to operate. And over 50% of that $300 billion comes from Medicaid alone. And over the last several years, Medicaid has seen cut after cut, state by state, making it much more difficult for them to operate. In regards to compliance in the regulatory environment, long-term care facilities have had a new acronym in PBJ, or the Payroll Base Journal. And they continue to get more coverage and staffing requirements and certifications that vary state by state. And then finally, it's the coverage. Every industry needs to make sure that they have coverage for their customers. What's unique about long-term care is this coverage is every hour of every day. No one ever turns the lights off and shuts the door to go home. The staffing coverage in long-term care and skilled nursing facilities primarily is based on what's called a PPD, or patient per day ratio. That's how many patients you have relative to your direct care. It varies by state, the different ratios. In a typical home of 40 residents, you're going to have 13 people scheduled every day. And the trickiest shift often is the night shift, because the night shift is going to have the fewest amount of people. Let's say, for example, only 2 people are scheduled. Well, if one of those people calls in sick or doesn't show up, you've lost half of your staff. And here's a great takeaway for the long-term care industry. The night shift is where we have our worst attendance. There's a couple reasons for this. First of all, the people that are stuck with the night shift generally had the least amount of tenure. Second, the big boss is gone. Facility manager has gone home. But worse than that, the staffing coordinator also has punched out. So if they don't show up, who's there to find a replacement? I remember when I was digging into this industry, I would join these chat rooms to see what these folks were talking about, learn the lingo and the like. I remember this one CNA, for the second night in a row, had one of their people didn't show up, which left them with 40 patients to take care of themselves. The attendance records of long-term care facilities rival that of fast food restaurants. So just as the staffing coordinator gets all of their staff, their CNAs, RNs, LPNs, PRNs, they get it all staffed just right for every shift, for every day, and then someone doesn't show up. Someone calls in sick.
So how does WorkSync help with staffing coverage?
It's a great question. What WorkSync does is it puts the tools into everyone's hands. So remember that department manager stakeholder I was talking about? So if someone doesn't show up, that key stakeholder can see that someone is not here and find not only a qualified person, but also with location services, how close they are. so they can get back and our residents can be taken care of. And really, those challenges, that's why we're here. WorkSync is designed to improve patient care while reducing labor cost and keeping you compliant.